Hello and welcome to News Across Nigeria. I'm Olumide Macaulay. On today's program, an advocacy group visits Delta states to create awareness on the perils of malaria. Osun State pensioners stormed the State House of Assembly complex over non-payment of their gratuities. And education in Cross River states gets the boost as scholarships are given. Thank you for joining us. We begin in the south-south part of the country and the health sector. Malaria is a life-threatening disease caused by parasites that are transmitted to people through the bites of the infected female Anopheles mosquitoes. Now, the infection by malaria, alongside other tropical diseases such as river blindness and elephantiasis, largely affect developing regions in Africa, Asia, and the Americas. The South-South Advocacy Group in Nigeria is visiting Delta State to seek the support of Governor Ifeanyi Okowa to help eradicate the disease. The group is also going from state to state to create awareness on how to stop the effects of these diseases.
The World Health Organization, more than 1 billion people, including millions of children, are affected by tropical diseases which are often neglected. 40% live in Africa, with Nigeria accounting for 25% of the African burden. Concerned about this, the South-South Advocacy Group on the Control of Malaria, led by former head of state General Yakubu Gowon, is visiting states to create awareness on the need to eradicate malaria, river blindness, elephantiasis and other neglected tropical diseases. The group's latest stop is the State House in Asaba, the Delta State capital. General Yakubu Gowon and his team appealed to Governor Ifeanyi Okowa's administration to help eradicate the diseases in the state.
We also would want to say that here in Delta State, about 1.7 million nets were distributed since the campaign began. And it is projected that in 2017, about 3.6 million nets will be distributed in the state.
While lauding the use of long-lasting mosquito-treated nets to check malaria, Governor Okowa observed that a holistic approach to tackling the issue would bring greater relief to Nigerians.
While I support the campaign in the area of providing the LLINs, the long-lasting system-treated nets, I think generally as a country, and particularly for those of us in the Ministry of Health at the federal level, we must continue to find other ways. Most countries are beginning to look just beyond the nets. We must look at how to do a control, a holistic control. And as much as possible, until we start to do a real combination, a drive to ensure a combination of the holistic control, both of the vector and the disease itself, we may not be achieving what we're supposed to achieve.
General Yakubu Gowon shares his experiences and challenges on tackling the scourge while working with the Carter Center.
Well, I think it was, in 1998 or 1999 that President Carter, during one of his visits to Nigeria, they've been having problem of this disease, guinea worm, not really reducing at all, and they were wondering why it was. So he thought of recruiting, that's what the word I use, recruiting generals to fight, not privates, but generals to fight, to help fight this disease. And I think it was a very wise choice because, he uses us for advocacy, contact with, from the top to the bottom.
Neglected tropical diseases are a diverse group of tropical infections which are especially common in low-income populations in developing regions of Africa, Asia and the Americas. They are caused by a variety of pathogens such as viruses and bacteria which thrive in unhygienic environments.
Also in the sector, but this time to maternal mortality, Nigeria has one of the highest rates in the world. Figures for the country varies between 800 to 1,000 live births based on the geographical location. In 2008, the figure for Lagos State, although slightly better than the national average, is put at 850 to 100,000 live births, or that is 650. For this reason, experts from different organizations, members from the Lagos State Ministry of Health, all gathered to brainstorm on new ways towards reducing maternal and child mortality in Lagos State. The country director, Dr. Tunde Segun, and the executive director, Child Health Advocacy Initiative, Mrs. Lola Alonge, urges the government to improve on health facilities in Lagos.
Generally, Lagos State is doing very well. Relatively better than the other states, especially in the northern part of the country. There is room for improvement, and that's why we have come. And we have shown that the areas where they thought they were doing very well with the DHIS 2.0 data, we have realized that they are not doing as well as they should be. So these scorecards have revealed it, and Lagos State is responding positively. The issues of finding out why did this woman die, why did this baby die, and we call it maternal and perinatal death surveillance and response. We have set up a state committee, led by the Honorable Commissioner of Health. We have trained healthcare providers in all the secondary facilities.
The focus of this program today is to see how we can save the lives of mothers, the newborn and children, especially in the area of raising awareness in issues like antenatal care. The mothers should report to the health facility before the pregnancy is up to 4 months, and not just go there, but also deliver at the health facility. A lot of them go back to the community even after attending antenatal and go to deliver with the religious organizations or the traditional birth attendants. There's need for the mother, for every pregnancy to be safe and every newborn to be safe as well. And that's the essence of this program. And we have what we call evidence for action. Statistics have shown that there's still a lot to be done. Our women are dying, our newborns are dying, and they can be saved if we act and everybody takes action. And that's the campaign of today. Everybody can play a role. The family can play a role. The husband can play a role by telling the wife to attend antenatal. The government can play a role by extending maternity leave. The community can play a role by taking ownership of the health facilities around them, which means if there's you don't have enough doctors, or you don't have enough drugs, or you don't have enough equipment, get the people in authority concerned to do something about it. And if they don't, you can mobilize yourself to do something.
And in the southeast, the Imo State government has lauded the federal government's policy of primary health care under one roof, which it believes will improve delivery of quality health care to people living in the rural areas. Health workers have been given a new orientation to be part of the vision with a forum organized by the National Primary Health Care Development Agency and the Johns Hopkins International Vaccine Access Center. Governor Rochas Okorocha, who was represented at the event, says the one roof policy will give room for better supervision, accountability and funding.
The objective of this forum is to give a better orientation to the new technical team inaugurated to drive Imo State's primary healthcare delivery system.
We have just been established.
Primary healthcare workers, as well as medical practitioners, are being retrained by the National Primary Healthcare Development Agency in collaboration with the Johns Hopkins International Vaccine Access Center towards implementing the federal government's new policy on primary health care under one roof.
I know that this workshop will enable the members understand their roles and responsibilities in the newly established Imo State Primary Healthcare Development Agency.
An executive member of the Imo State Primary Healthcare Development Agency is optimistic that all issues associated with the state's healthcare delivery system will be sorted out.
There were some levels of decay, and then inefficiency, dilapidation, and then poor linkage between the community and the facility that the service. So that is why this revitalization and reformation is taking place to reposition the primary healthcare to function optimally.
However, healthcare development partners in the state are seeking the participation of various communities to ensure that the healthcare delivery system is properly maintained.
In a primary healthcare system, before you would have people who work in the PHC system being employed by different agencies. At the local government level, the health workers would be employed by the local government, the doctors would be employed by the state government. So it made it very difficult to coordinate and ensure accountability. This reform, therefore, now creates a state-level agency that manages everything that has to do with primary healthcare. So it's one management, it's one funding source, it's one evaluation and one planning system.
Nevertheless, the Okorocha administration says it remains committed to the people's healthcare needs.
If there's anything that bothers the present administration in Imo State, it is that of giving quality healthcare delivery to the people of Imo State, especially those at the rural areas who are there to access the primary healthcare in their various localities. So with this training, like I said earlier, every participant will know his or her role towards giving this quality healthcare delivery at the rural areas.
The primary healthcare delivery system is designed to cater for Nigerians who seek first-level healthcare services. The healthcare under one roof was set up to improve on the present structure by providing universal coverage in all primary healthcare centers across the country.
You're watching news across Nigeria. Coming up, a bill to accord Lagos State special economic status passes second reading at the House of Representatives. Please stay with us.